Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Types of blood vessels. So the first one we are looking at is the Wind-Kessel. So Wind-Kessel vessels. So what are the Wind-Kessel vessels? Wind-Kessel vessels are, it includes aorta. So there's aorta and also the large arteries. So aorta, large arteries, then comes abundant elastic tissues. And this is present in the inner and the external lamina. Inner and the external lamina. Then comes, it shows the elastic recoil. This is known as the Wind-Kessel effect, and this is seen when it is stretched. Next type is the resistant vessels. So resistant vessels, it includes the arterioles, and they have a less elastic tissue and loss of smooth muscle. So it has loss of what? Loss of smooth muscles, that is, it is maximum wall thickness to the lumen ratio. Then it is a major site of the resistance to the blood flow. It is a major site of resistance to the blood flow. Next is exchange vessels. So exchange vessels, there is presence of capillaries, and they do not have smooth muscles and consist of a single layer of endothelial cells. So they contain the capillaries, and they do not have smooth muscles, so no smooth muscles, and it consists of a single layer of endothelial cells. Single layer. So single layer of what? Single layer of endothelial cells, and it is surrounded by the basement membrane. So where is the basement membrane present? Basement membrane, what it does is, it helps in the basement membrane. It is surrounded by the basement membrane. The site of exchange, it forms a site of exchange of the nutrients, water, as well as the presence of gases. Now, what are the types of exchange vessels? The types of exchange vessels, it includes the continuous. The continuous, it includes the brain and retina. So continuous, it includes the brain and retina, and they have tight junctions. Retina having tight junctions, then fenestrated. So what is meant by fenestrated? Fenestrated, there is presence of the glomeruli, and there is also the presence of the choroid plexus. Then comes the sinusoidal. The sinusoidal, it includes the spleen and the liver. So the blood flow regulation is by the contraction and relaxation of the arterioles and the precapillary sphincters. So there is a regulation of the contraction and the relaxation. So contraction and the relaxation of the arterioles and the precapillary sphincter. Next, what is present is the capacitance vessels. So capacitance vessels, it includes the venules and the veins. So capacitance vessels, it includes the venules and the vein. This is nothing but a thin-walled early distensible. It is thin-walled and early distensible. That is, there is presence of the maximum percentage. There is maximum percentage of the blood vessels, blood volume. Next is presence of the shunt vessels. Shunt vessels, there is presence of the anastomosis, that is the AV anastomosis, and they have a thick muscular wall and rich innervation. They have thick muscular wall and the thick muscular wall with rich innervation, and shunt vessels, they are found in case of the fingertips, the earlobes. To learn and grow daily like this, please do subscribe.